introduce our digestive system doctors. Dr. Green, Dr. Shireman, not here today. Dr. Martin, Dr. Hall, Dr. Penn. I am an intern, Dr. Reese.
What is an ulcer? An ulcer is bacteria that eats through the outer lining of your stomach. There are stomach ulcers, peptic ulcers, esophageal ulcers, duodenal, and gastric ulcers. And Dr. Friend will be talking about peptic ulcers later. Foods to help prevent ulcers is broccoli, yogurt, honey, Brussels sprouts, cauliflower, and fruits. Ways to help avoid ulcers is avoid spicy foods, avoid fatty foods, avoid stress, practice moderation, avoid smoking, avoid alcohol, do regular exercise. What is GERD? Gastroesophageal reflux disease. This is when stomach contents leak backwards from the stomach into the esophagus. GERD prevention tips. Eat smaller meals. Elevate your head. Lose weight. Avoid spicy foods. Avoid laying down right after eating. Medication can increase your risk of GERD.
What is constipation? Constipation is when a person's stool is dry and it hurts when you eliminate it. Being constipated means a person is not drinking enough fluids or eating enough fiber. How to prevent constipation? Eat more fruits and vegetables, have a proper diet and more exercise, drink more fluids and don't ignore passing gas.
What is celiac disease? Celiac disease is autoimmune, which means celiac disease automatically makes your body healthy. It damages the small intestine and the villi in the small intestine. Prevents absorption of nutrients from food. And gluten, which comes in a lot of food, causes the body to attack itself. Gluten is found in wheat, barley, and rye. If untreated, can lead to osteoporosis, thyroid disease, or cancer. This is a picture of gluten. How to prevent celiac disease? Have a gluten-free diet. Avoid all foods made from wheat, barley, and rye. Avoid bread, cereals, pastas, crackers, cakes, pies, cookies, and any gravy. Avoid oats and processed foods. Prepare gluten-free recipes.
I'm here today with about celiac disease. I'm going to ask you a few questions. First, I'm going to ask you, how did you know you had celiac disease?
Well, I actually had to get some testing done because I had a lot of stomach complications, and my test came back showing that I had celiac disease. It was a blood test.
What stuff did you try to stop it?
I quit eating gluten, which is in wheat, barley, oats, and rye, so I can't eat bread and regular noodles and some potato chips and like pretzels and things. I have to eat a special diet.
And how did it affect your life?
Well, I have to think about what I eat every time I eat. So when I go out to eat, I can't just have a big juicy hamburger with a bun because I can't eat the bun. And when I go grocery shopping, it's really expensive to buy foods that don't have gluten in them. So that's how it affected me.
And that was the lesson.
What are peptic ulcers? Peptic ulcers are acid and bacteria that eat the outer lining of the stomach. And here are some symptoms of peptic ulcers. The symptoms are diarrhea, belly pain, loss of appetite, and vomiting, and bloating, which means your stomach gets bigger. The disease, how to prevent from getting peptic ulcers. You avoid drinking alcohol, smoking, and don't eat spicy foods.
Who had acid indigestion? Oh. Is he not doing it?
Jaquan, do you want to talk? You can look off the screen. No?
Can someone do it for him?
Jaquan, pick a friend. Oh.
Acid ingestion. Due to the contents of the stomach back up through the esophagus. Symptoms include heartburn, upset stomach, can often be confused with a heart attack. Preventions: eat fewer spicy foods, avoid smoking and drinking alcohol.
When you swallow food, it travels through a tube called the esophagus. The esophagus leads into the stomach through a hole in a sheath muscle called the diaphragm. There's a round muscle at the bottom of the esophagus that works like a valve. The muscle relaxes when you swallow, allowing food to pass into the stomach. Certain cells in your stomach, called proton pumps, release acid to help digest the food. The lining of your stomach protects it from the acid. The esophagus has a different type of lining, which looks like it's made of smooth tiles. The valve is designed to close tightly after you swallow, so nothing comes back into the esophagus. Your diaphragm is also meant to pinch securely around the esophagus, closing off the opening to your stomach. It's normal for a small amount of acid to occasionally splash into the esophagus. This is called reflux. That word means flowing back. A small amount of reflux doesn't usually cause any harm. But if acid splashes up into the esophagus over and over again for years, the esophagus can be damaged. There are several reasons this might happen. It's not uncommon for the valve to become weaker, so it doesn't close tightly. That allows acid and partially digested food to come up into the esophagus. Sometimes the diaphragm weakens around the esophagus, allowing the hole to become larger. This hole is called the hiatus. When it becomes larger, part of the stomach may bulge through it. This is called a hiatal hernia. The hernia may cause the esophagus and the valve to move up. In that case, the diaphragm is no longer reinforcing the valve. That makes it more likely that acid will get into the esophagus. When acid and food splash up into the esophagus repeatedly, it's called gastroesophageal reflux disease, or GERD. Gastro for the stomach, or gastric system. Esophageal for the esophagus. Mayo Clinic's Division of Gastroenterology and Hepatology is recognized as #1 by U.S. News and World Report. Go to mayoclinic.org to find out how to request an appointment with a Mayo Clinic physician.
Mm-hmm.